As a new patient, I would like to talk to you about medication options to help you transition, including medication choices, physical changes and expectations from hormone therapy, the possible side effects, as well as cost information. Many patients are very eager to see rapid changes. However, it is important to remember there are many individual factors that affect how quickly you will see changes, as well as how significant those changes are. Some of these factors include your genetics, the age at which you start hormone therapy, as well as your overall health. It's important to think about the process as a second puberty, and puberty takes several years for full effects to be seen. The medication used to help patients masculinize is testosterone. Testosterone is available as an injection, a topical patch, and a topical gel or cream. All forms of testosterone are considered equally safe and effective. The majority of our patients use the injectable form of testosterone. This is frequently the form insurance prefers, and patients often prefer it as they usually see physical changes more rapidly. The blood level of testosterone can be more variable with the injectable form. However, the majority of our patients give themselves an injection weekly, which can result in more stable blood levels. The testosterone gel is the second most common form used by our patients. It does provide more consistent blood levels, but physical changes may take longer. There is also the risk of the testosterone being transferred from your skin to the skin of a woman or child. The gel is applied to the upper shoulder area and can take several hours to be fully absorbed. We also recommend waiting a couple hours after applying the gel to get the area wet. The testosterone patch is the least common dosage form used, mainly due to insurance barriers. However, it also causes a significant amount of skin irritation, and a large percentage of patients are unable to tolerate this irritation. It is important for us to discuss the irreversible changes of testosterone. One of the first changes after starting testosterone therapy is deepening of the voice. Patients often notice their voice starting to change within a few weeks, but all patients go through different stages of voice change. It will take up to 1 year to achieve the full deepness of your voice. Changes in facial and body hair are also permanent. The hair on your body will become darker, thicker, and will grow faster than before starting testosterone. Facial hair will also develop, but it is important to keep in mind that beards vary from person to person. Some people develop facial hair rapidly, but for others it can take several years. It can be helpful to look at men in your family to get an idea of what your body and facial hair may look like. But every person responds to testosterone differently. Baldness is another change that is not reversible, but this change is very dependent on genetics as well as a person's age. Most people notice thinning hair around the temples after starting testosterone, and most patients continue testosterone throughout life. Thinning scalp hair or balding generally happens as people get older, and genetics usually follow the mother's side of the family. So it may be helpful to look at men on mom's side of the family to determine what may happen to your scalp hair over time on testosterone. The clitoris will also increase in size, and this change is also not reversible. Lastly, it's important to understand that using testosterone may make it very difficult to become pregnant, and over time you may even lose the ability to become pregnant. However, if you are sexually active with non-transgender men, you should not depend on hormone therapy as a form of birth control, as it may still be possible to become pregnant while using testosterone. Next, I would like to discuss additional effects of testosterone, which are reversible. One of the first things patients notice after starting testosterone is their skin becomes more oily and thicker. You may also notice you sweat more, and the smell of your sweat and urine may change. Because of the increase in skin oiliness, most patients do develop acne after starting testosterone. Acne is usually worse the first year after starting testosterone therapy, and then will improve. There are many medications we can use to treat acne that are covered by insurance. So make sure to let your clinic know if you are interested in being prescribed a medication to treat acne. Periods completely stop for the majority of patients within a few months of starting testosterone therapy. If you have a return of vaginal bleeding at any time, it's important to let your doctor know. Most of the time, we just need to adjust your dose of testosterone. However, there are other more serious causes the doctor will want to rule out. Vaginal dryness can occur after starting testosterone due to significantly lower levels of estrogen. For some patients, this can cause vaginal pain. If this happens to you, please let your doctor know. There are topical creams patients can use to help with this dryness and pain. Lastly, I would like to talk about changes in fat and muscle. Fat will tend to decrease around the hips and thighs. It will also decrease in the face, giving a more angular and masculine appearance. For some patients, they may notice a very small increase in fat around their stomach area. Unfortunately, testosterone will not change the amount of fat in the breast tissue. Your arms and legs will also develop more muscle definition, but in order to change the size of your muscle and increase your strength, you will need to participate in weightlifting exercises and eat a healthy diet. As we discussed on the previous slide, acne is one of the primary side effects of testosterone therapy. Testosterone will also tell your body to make more red blood cells, which is also known as increased hematocrit. The risk is that your blood may become too thick and can increase your risk for things like heart attack, stroke, or other conditions. This is usually only a concern if you are taking a testosterone dose that is too high. We monitor both the testosterone level and hematocrit level in all patients very closely. We also monitor your liver, as in the past, an oral tablet form of testosterone was used, but it caused damage to the liver, and this is why we no longer use an oral tablet. It is unclear if testosterone affects the risk of cervical cancer or breast cancer, and routine screening for both will continue to be recommended depending on your wishes for surgery. As an example, if you have interest in top surgery and have removal of your breast tissue, you will no longer need breast cancer screening. Additionally, if you have interest in full hysterectomy, which means removal of the cervical tissue as well as the uterus and the ovaries, you will no longer need cervical cancer screening. The HPV vaccine significantly reduces the risk for cervical cancer, and we recommend getting the vaccine if you have not already received it. Lastly, I would like to discuss the cost of testosterone. The good news is most insurance will cover testosterone injection. Some insurance will also cover the testosterone gel or patch. You will notice two different forms of testosterone injection listed. The two testosterone injections are considered equal, and the only difference is that testosterone cypionate is mixed in cottonseed oil, and the testosterone enanthate is mixed in sesame oil. If a patient does not have insurance and has to pay cash, the injectable form is around $100 for a 5 to 6 month supply. Thank you, and please don't hesitate to reach out to the clinic with questions or concerns.